Thanks for sticking with us here on Fox 24 News AM Live, and it's time for this Wednesday's health segment with Dr. Bill from Paradigm Physical Therapy. Hi, Dr. Bill.
Hey, how you doing?
I'm good. So what are you telling us about today?
So we're talking about headaches, and headaches are they're just a huge problem. They're a pain in the neck and pain in the head too, but there are over 12 different kinds of headaches that people can suffer through. And it causes about 130 million days missed in America.
Wow.
And that's a lot. And then it also costs the American public $30 billion worth of medical expenses every year. And if that doesn't cause a headache, I don't know what does.
Right?
Yeah.
Well, what are the causes of some of these most common headaches that people have?
So the most common headache is what I call a cervicogenic headache. Cervico means neck, genic means to be created from, and so most of the headaches that we have are cervicogenic headaches. A second one is called a tension headache. Now a lot of people are, they hear that, well, I've got a migraine headache, I've got a migraine headache. Now migraine headaches are actually a little bit different than what the doctors may be telling you, but they use the word migraine to give you something to put a label on it. Cervicogenic headaches are a little bit more difficult to talk to your friends about. So cervicogenic headaches come from the neck, and tension headaches come from the head and the neck. So those are really not that hard to treat. Unfortunately, I have patients that come in and have had headaches for 20 years. And within a couple of weeks, they have no headaches. And I actually have a patient right now who's driving from far away, so I can treat her headaches. So it's really it's not a hard thing to treat. Unfortunately, we head down that road of medications, MRIs, and other kinds of tests. They're not that hard to treat.
Now, is that the most common kind of headache that you treat at Paradigm Physical Therapy?
Yes. So when somebody comes in and they say they have headaches, I do a full neurological evaluation on them. I also check their jaw and their mouth out, because a lot of times, especially with women, probably because they deal with us men, but they have headaches more so, and then they also have jaw pain too. So jaw pain and clicking of the jaw and the headaches all go together. So it's not just treating, just the headache. I also treat the jaw and other areas, and we especially work on posture. Posture is critical for working on and treating headaches.
Now, how exactly do you treat those? Is there a special machine, or is it just certain exercises that maybe you can teach people?
Well, mainly it's education. We need to tell people that their phones don't go like this. They come up like this. It's not that hard, but we just don't think about it all the time. Second of all, I put them on some very stringent exercises that they can do at home. Also, I do some manipulation on the neck and the thoracic region, possibly the lumbar, and then I also do the dry needling that everybody talks about. The dry needling really gets in and works on those muscles that are causing the issues that go up into the head, and it works extremely well.
Could you just quickly remind people what dry needling is for those who maybe haven't heard in previous segments?
Right. So dry needling is where I take an acupuncture needle, okay, it's a filament needle, and I put it in the muscles and the areas that are causing pain. And as I move the needle around, it releases the trigger point. And once you release the trigger point will no longer, or actually decrease, in creating the pain that goes up into the neck and the head. And so that is, and I've been doing that and teaching it for almost 15 years now. So I teach dry needling all over the United States. So it's a very effective way of dealing with this. And there's no narcotics, there's no medications. You feel better almost within the first week or so.
Okay, and so how can people get in touch if they want to set up an appointment or if they want to get more information?
Right, so they can call my office at 580-3300, and they can talk to my wonderful, wonderful front desk people, and they can go ahead and make an appointment. And you don't even need a prescription anymore. You can come see me without a prescription.
Great. Well, as always, thanks so much for coming in and giving us the latest, Dr. Bill.
All right, thank you, Caitlin.